Good evening. I'm Jeff Oxendine, and I'm the Associate Dean of Public Health Practice at UC Berkeley School of Public Health. I'm also the founder and president of MyHCN Navigator and of Health Career Connection. It's my pleasure to welcome you to our webinar this evening. The topic is one that I get asked all the time from people who are at the undergraduate level, the graduate level, recent graduates, trying to decide which path that they should take. And we're really talking tonight about how to combine clinical careers and public health. And we're really this is a part of a webinar series that we've had this fall, where we started by talking about graduate options in public health and why go to graduate school overall. We then transitioned to graduate options in health policy and management, and then talking about dual degrees. And those webinars are archived, and I would encourage you to take a look at those or listen to those. And then tonight we're really focusing more on how do you combine public health and clinical careers. Some of you have big questions like...
Pretty much. We have two outstanding panelists today that will be talking to you that both have an MD and PhD degree. And today you'll get the opportunity to talk to Kathy Handy and Paul Haydes. And we're going to start today with Kathy Handy. Kathy got her graduate degrees from Johns Hopkins University, and she's currently a doctor there at the present moment. So we're going to kick things off with Kathy right now. So let me turn the panel over to Kathy, who will introduce you to who she is and what she's currently doing right now.
I went to Harvard for undergrad, and there I was working with a professor in the School of Public Health. So I was actually thinking initially while I was in college about doing more public health and less clinical medicine. What drew me to clinical medicine initially was that I wanted to take care of patients and do things very individual level basis, which you do as a doctor, and be one-on-one with patients. So that's what initially drew me to medicine. Once I started medical school at Johns Hopkins, I realized that a lot of the things that I've been doing in public health you don't get as much of in medical school. And I felt very removed from a lot of the big picture, really population level things that I was thinking about in college that, again, you don't get as much as in medical school that I had been doing in college. So I was thinking about doing an MPH, and I got a lot of different advice because there are a lot of different times that you can do it, or you can do it not at all. So in medical school, every medical school nowadays has some sort of public health curriculum, but it's definitely not as extensive as doing an MPH. And then there's the big question about when to do it. Do you do it during your medical school career or afterwards? And for me, I sort of decided that I was very broad. I didn't have a exact idea of what specifically I wanted to do for the rest of my career, so I used it more as a learning opportunity and a guiding point for what I was going to do in the future, versus where some other physicians who do it later on in their career go into it with a very specific idea of what they want to get out of it. I went in sort of very open-minded when I started my MPH. So I did it between my third and fourth years of medical school. So I had an idea about what specialty I wanted to pursue. And while I was there, most of the physicians or people in medical school were doing epi and biostats, which I did. And it's really like learning an entirely different language, which you do in medical school, but then again you do during your public health years too. But then I also had an interest in public policy, and so I also did health systems and policy while I was there. So I was sort of dual concentrated in both of those things. And then since then, it has been very useful. I was able to, once you have those degrees, you sort of have the language to talk to people, and people sort of know, okay, here's what you've done, so now I can see why, the things that I want to do in the future make sense for the things that I've already done. So I am in my last year of internal medicine residency. I did some rotations at Health and Human Services while I was in residency. Working on some of the Let's Move and then also the Million Hearts campaign that they had, a lot around physician behavior. And now I'm applying in oncology, and I'll do prevention and health outcomes research, which again, now that I have my public health degree, people say, okay, this sort of makes sense. And I'm able to more easily communicate with a lot of the people who are not clinicians, who have the public health background, because I have all of that formal training already, but then also obviously on the clinical side. So that's sort of what I've done, and then what I hope to be doing in the future. I know Dr. Haddis is a little bit farther along in his career, so can maybe answer some questions about what happens later, but that was sort of my decision-making process for how and why I chose both degrees.
So a quick question for you, Kathy, is what was the toughest thing for you to manage while you were in school?
So the toughest thing for me to manage while I was in school, so it was actually, it wasn't hard going from medical school to public health because the hours are much different. Medical school is very time consuming, and it's things that you don't learn really in any other place. So again, it's like learning an entirely new language, and it's a very time consuming language, and you sort of feel like you're never going to learn everything that you need to learn. And then it was hard initially to sort of switch that entirely, because so the motto of the Johns Hopkins School of Public Health where I went is saving lives millions at a time. So you really go from thinking like you're saving one life at a time to thinking about like millions of people at a time. So you really need to change your sort of entire way of thinking, and then even the way that you talk about things with your colleagues as that changes. So I think that was the hardest part, sort of getting used to the new language of medicine, and sort of and it can be stressful at times because it's a lot of work and it's a lot of things that you need to know. And then sort of leaving that and then thinking in entirely new ways that you didn't have before, or that you hadn't been doing for the past 3 years. Now I think that it's easier, now that I have both of those things, to think about and manage sort of simultaneously. But going through school, those were probably the hardest things.
Okay, awesome. Another question that was so how did you decide on I'm guessing that you had a lot of options. What specifically about Johns Hopkins did you decide to go to that medical school?
So I'm totally biased. I've been here now for 8 years. I love Johns Hopkins. I think everybody should come here. It's my sort of my bias to start with, and that's my disclaimer. When you're applying for medical school, or when you're applying for medical school, you have the benefit of having to go on interviews, which doesn't happen for college. And then when you go on these interviews, and it doesn't happen for schools of public health either. There's like no interview process. The benefit for medical school is that you have to interview, but you have to go to those schools, and then you end up meeting with a lot of students and a lot of faculty members. I found that Hopkins was a place where I sort of fit in best. The faculty is very, very accessible, and at a big place, it can be easy to get lost. So you want to know that the faculty who are there for you and are generally the reason why you go to these places are going to be there to help you and to help you navigate and like answer your questions and be there to support you and support your career. So this was one of the places that I found to be the most supportive and encouraging, and everybody sort of talks to everybody, and everybody's door is an open door, and it's just as easy for me to talk to the person who's one level above me as it is to talk to the chairman of medicine or the CEO of the hospital. So that was sort of the culture and the environment that I wanted to stay in. I will say the other benefit of doing the MPH during your medical school years, or even while you're in some sort of training, so even like residency or fellowship training, that you can oftentimes get it paid for. So if you do your MPH before medical school, oftentimes then you have to take out loans. And a year of tuition for my MPH year was a higher tuition than my medical school. So it's very expensive, but since I did it at Johns Hopkins while I was a medical student, I was able to get funding through the school. So that was definitely why I stayed, and Hopkins School of Public Health was the only school that I applied for because I had these relationships already and knew that I would get funding. So that's why I came here initially, but then also one of the benefits of staying wherever you are to do your MPH if you're in medical school there or wherever you're training.
We have a couple of questions for you from people in the audience. One person says, "Hi, Kathy. I'm an undergraduate interested in an MD/MPH program. What are some of the types of opportunities I should look for and get involved in during my time as an undergraduate to help me explore these fields?"
Okay, so that's a great question. So they're very different. So the first thing that I would encourage undergraduates to do to sort of look for opportunities is to look for professors at your university that have both of those degrees. Because a lot of people who have both of those degrees are using them in some way. Like either their research is more focused on population health or their clinics may be different, but they tend to be doing something with both of them. So I would first say, if you're an undergrad, to look for professors who have the degrees that you're thinking about and just see what types of things that they're doing. If you're interested in doing medicine, I do recommend that it's beneficial for people to see like what being a doctor means. So either in the hospital or in the clinic, so try and do something like that. Public health or the careers that can come after a degree in public health are so varied. So it would be hard to say like to do one thing or even a couple of things because people can really go on to do a million different things. But if you're interested in both, I would say first find somebody who has those degrees and then go talk to them would be a good first place to start.
Okay, the next question for you, Kathy, is it a good idea to start with interest in public health when it comes to school? And how do medical students want to combine medicine and public health?
So I think people are generally receptive. I think anything in general that you're thinking about, like, so first of all, I did a lot of medical school admissions and now residency recruiting too. So one of the things that always came up, we know that people always change their mind when they're in medical school. So we have tons of people who come in saying that they're going to do X, Y, Z, and they leave doing completely other things. So don't feel like, whatever you go into medical school doing, you have to leave medical school doing as well. But if you do have a genuine interest, then it is best to express that interest. Medical schools in general are just, especially during the essay and then also during the interviews, just want to know like sort of why you're in it and what it is that excites you about medicine. So if combining the two degrees or like what brought you to medicine in the first place was work that you did that had more of a population health bent towards it in contrast to like something that was very one-on-one patient-based, then express that. But whatever it was that got you excited about going into medicine is what you should express to the admissions committee. But I will say, if all that you're doing is public health and it's unrelated to medicine, then I would think about a way to sort of tie in the medical school aspect for it. But really, you should just express whatever it is that gets you excited and sort of brought you to applying for the medical school, because genuine interest comes across, and if people, if you're not genuinely interested in things, then that also comes across too. So you really just want to, express whatever it is that you've been doing, the things that you talk to your friends about, work that are exciting to you, and the things that wake you up in the morning that are bringing you to, spend lots of money really to pursue this career. So it's not a small decision, and if there are things that excite you about it, you should convey those things.
Awesome. Next question for you is, when did you apply to get into the MPH program? And can you explain further why you chose not to do an MPH after you had finished the 4 years of medical school?
Unmuted.
Okay, so that's another good question. And I'll tell you, this is my opinion, and I got a lot of different advice about this, so it totally depends. So the application process, it was actually this time of the year during my 3rd year of medical school. So it's like September, October. I think the applications were due like in November and December. When you do the actual application process for MPH schools. The question of when to do it during medical school or afterwards, again, it's sort of an individual basis, and it sort of depends what you want to get out of it. So I was sort of thinking of it, well, as more of like an exploratory thing, and like I had a kind of an idea, but I wasn't exactly sure what I was going to be doing after medical school. But I knew that I'd done things before medical school that were of interest to me, and I knew that I wanted to bring those things into my post-medical school life. But I wasn't sure like how all of that was going to fit together. So I saw it as let me do this formal training program where I get more exposure, I'll have more research opportunities, and a year off from medical school to pursue these other interests, and then I can, now that I've done 3 years of medical school, can tie it into whatever it is that I'm going to do in medical school. So for me, I was sort of seeing it as a way to shape what I was going to do after medical school. Other people who do it after medical school say that they wait until they have a very specific thing. So they'll say, like, I want to do phase 2 clinical trials in oncology, and they'll say, I need to go do an MPH so that I can learn very specifically how to do, like phase 2, like run clinical trials, and that's what I will do. Or they'll say, I am a cardiologist, and there are all of these huge databases, and I have these specific questions that I want to answer from these databases, and this is what I'm going to do. So I'm going to go to MPH school so that I can learn how to do these things, and that's what I'm going to use it for. So when people do it later in their careers, they tend to have sort of very specific things that they want to get out of it, and again, that's a generalization. Obviously, it's not everybody, but people who are farther along in their career tend to have more of an idea of what their career is, whereas if you do it in, when I did it in medical school, my medical school classmates who were doing it with me at the same time, we were sort of using it to shape what our future career was going to do and to try and put together like what our future career was going to be.
All right. Next question for you is, can you explain your thought process in deciding to concentrate in epi and biostats for your MPH?
Unmuted.
Okay, so I think really that almost every physician, at least every physician who's going to be doing some research, should do the epi and biostats classes, mostly because they are very useful just in terms of reading all of the journal articles and interpreting all of the evidence that then you're using in clinical practice. So initially I was thinking that I knew that as a physician at some point I would be using these skills for research opportunities down the road. And even for the research that I was going to be doing during my MPH, that I would be using those skills. But then I also found that I was able to, it was easier for me, and I had a different understanding of a lot of the journal articles that I had been reading after I had that background in epi and biostats. So that's why I did that. Again, my interests before were in health systems and policy, so I also the curriculum is so flexible that you can almost do whatever you want. So I was able to do both of those things, but I did find it helpful just from a clinical perspective, even like with small things, like when you're explaining data to patients, if you have a very solid foundation, and again, you don't necessarily need a master's of public health to do that, but it definitely helped me, like for reading articles, writing papers, and doing analyses myself.
All right, a question that comes from Alexis. Did you do your MD and MPH as a dual program? And if so, did you feel like you lost any MPH experiences since the degrees were combined?
So that's another good question. So I did not do them as a combined program. I don't think Hopkins may now technically have a combined program, but it doesn't. It's actually, it's still an extra year. So the Master's in Public Health program at Hopkins for everybody is an 11-month program, and I did the full 11 months that anybody would have done, even if you weren't in medical school. So I didn't apply to medical school saying that I was going to do like a combined program. It was something that I decided on during medical school, and there was I didn't save any time, so I had to do the full 4 years of medical school and then the full year or 11 months of the MPH. But some programs do have it where, like your 3rd and 4th year of medical school, you do your MPH, but that's not what I did, so I can't really speak to that.
Okay, Kathy. Next question is, if you would have one piece of advice to give to a student thinking about applying to, thinking about getting an MD and MPH, what would that piece of advice be?
So really the major piece of advice is to just make sure that it's what you want to do. I do a lot of advising, and a lot of people sort of go into it thinking like, oh, it sounds great, so I'll just do it, but it is a big commitment to sign up, especially for both of them. So, think about sort of what you want your career to be, what you want. Even committing to medicine is 4 years of school and then at least 3 years of postgraduate residency training if you choose to do that too. So just make sure that you've thought about what it is that you want to do after school, or like what type of career in general. Like, do you want to see patients or not before you apply? Because it's definitely not for everybody, and there may be like a different combination of degrees, or even one of the degrees and not the other that might be better suited for you.
A person in the audience asks, are there any particular fellowships that you think individuals should be looking for? Because medical school is very expensive, and public health school can be very expensive depending on where you go. So are there any fellowships that folks should be thinking about?
I'm muted.
So I don't know about any fellowships that would pay for medical school and MPH. So most MD, PhD programs, you can do your PhD degrees in public health, and they'll pay for medical school. The only other ways to get medical school paid for, some schools have different financial aid depending on what school you go to, and different scholarship packages sort of depending on where you go. And then there are like National Health Service Corps and national programs that you can do to get medical school paid for. For school of public health, there actually are a number of ways that you can get it paid for through medicine. So most medical students can get it paid for through your medical school. And then some residency programs, but almost every single fellowship program, clinical fellowship program. So like you do medical school and then it's 3 to 7 years of residency, and then after that you can do subspecialty fellowship training. So most of the subspecialty fellowship training programs have funding for people to do master's degrees. And those don't need to be masters in public health, but they can be. So outside of that, though, I don't know of many ways to get medical school paid for.
One final question from someone is like, where do you see yourself in 10 years?
That's a good question, and I've had to answer that a lot recently because I'm on the interview process for fellowship. So I want to stay in academic medicine and have a research career. I'm going to do oncology, so I will be a clinical oncologist. And then have research focused on cancer prevention and comorbid disease in cancer survivors. So in 10 years, hopefully I'll be at an academic institution as a professor.
Outstanding. Well, thank you so much, Kathy. We really appreciate it. Kathy's coming all the way from the East Coast. And she decided to to come in and help as much as possible to answer all the questions that you guys may have, because we understand that the medical school MPH process is very difficult, very challenging, specifically for students who are first generation students trying to apply for med school. It's incredibly daunting, but Kathy was real quick in saying yes and to giving us some time today. So I want to thank you so much, Kathy, for joining us today and helping us out.
My pleasure. Thank you, guys.
All right. All right, we're going to move on to our next panelist, which is Paul Haydes. And Paul is currently an associate professor of public health and community medicine at Tufts Medical School. He's got an MD, MPH, JD. He's got it all. So with that said, we're going to turn things over to Paul. Paul, are you on the line? Paul. Sorry, we're having a little...
Yeah, hi, can you hear me?
Yeah, I can hear you perfectly.
Can you hear me now?
Perfect.
Great, okay, I hope I'll stay unmuted. And it was a delight to follow Kathy because Kathy's at a point in her development where she's sort of both close to medical school, close to public health school. As a student now and finishing up residency on the fellowship, I last finished my training 25 years or so ago. So I have both some personal reflections, but also since at Tufts Medical School, I'm involved in helping to run an MPH program, and we also have a 4-year combined MD MPH program. We also have a vet MPH program, actually other combined, but focusing on the clinical side. I'm happy to sort of share some perspectives from that point of view as well. Let me just say a quick word about myself, though. So I was part of a joint MD-JD program some 25, almost 30 years ago. And the thing I want to say is, and it's true whether it's law or public health, let's say combined with medicine, there's definitely a variety of different skill sets. So when you learn something in a clinical care specialty, caring for individual patients, and then you go to public health school or even law school, which tries to, at least in some ways, sometimes prepare you to think about things at a larger population level or policy level. I think an important question for all of you guys in this webinar is I would say a couple of things. One is follow your passions, as Kathy suggested, but also ask yourself, do you really want a career where you're really working more one-on-one with people? Do you want a career where you're working more on sort of, I call bigger picture issues? Or do you want a career that combines both? I mean, one of the advantages of a clinical career combined with public health is it does give you that opportunity, at least over a career. And for some people, they actually, if you look at their, given week of how they spend their time, part of it is sort of one-on-one, often clinical medicine, and part of it might be health policy issues. It might be research tied to public health and population. So there's different ways of putting it together. I think what I want to say a few more things, and we can sort of, I can direct more comments based on what people's interests are. Since Kathy spoke a fair amount about MD and PH programs, let me give you a slightly different model, one we have at Tufts, just to jump away from myself for a moment, other than to say I've had a career where while I did some internal medicine training early on, I've really been somebody who's worked more on the population health side, including law and population health at times. And I would say my clinical or my one-on-one time in the last 10 to 15 years has evolved more about what do I offer individual students educationally or as a mentor and advisor one-on-one, and less, but not so much in a clinical patient care realm one-on-one. But just to comment on the MD, MPH programs a bit. So there are different models, if that's of interest to some of you on the call. There's the model that Kathy sort of identified, which I'm calling sort of the 5-year model. Now, in her case, I'm not sure she went to medical school necessarily thinking she was going to do an MPH degree for sure, but she was able, after the sometimes after the second or third year to go and do an MPH completely, and there's some advantages of that approach, also some disadvantages. I'll come back to time and money. And then the MD MPH, like we have at Tufts, which I forget the exact proportion, maybe about half of the medical schools that offer a combined degree with an MPH do it this way. It's structured so you actually do it over 4 years, and we do that by both carving out with the medical school's overall participation time during the week where there is no competition with medical school classes. So for example, at Tufts, there's never, in the basic science years, first couple of years, any scheduled things on Tuesday afternoons. So that allows our students to take MPH courses then. And they do that for a couple of years, and in their third and fourth year, when they're in clinical work, they actually, in the spring of each of those years, take a month off of their clinical work to do sort of full-time additional elective courses. The thing I want to say about our model is we discount, we're a private medical school, expensive, and so going to medical school at a place like Tufts, is up there, $60,000 a year. We offer that 4-year, the additional MPH degree at a significant discount. So about 40% of what you would pay for the tuition if you just came to us to do the MPH alone. And again, a good number of medical schools that do combine MD MPHs do discount it. Let me go right to the heart of the challenge, though, because I think this was embedded in one of the questions. If you said to me, educationally, are there disadvantages sometimes of the MD MPH? And I would say yes in this way, that I do think there's some value in Kathy's model of because medical school can be so all-consuming, to sort of have a block of time, and she had an 11-month block, to really step away from clinical medicine and really focus on public health and population health. I think there can be some advantages of that just in terms of not having competition for your time, although I'm very impressed with our students at Tufts, how they get through and focused on their medical school work, especially those first couple of years, basic science oriented, but also do have time to carve into it, preparing for their public health classes. But if one of those gets sacrificed, I would say they probably spend less time on the public health piece, just because I think for most of them, medicine and their training and boards and all that becomes an important focus. But a major advantage is you do finish in 4 years. So you're saving a whole year of time, and again, in some cases, discounted tuition. Let me make one other comment about the timing of MPH, and maybe we should just open it up from there. A lot of people come to me and say, well, when should they do an MPH degree? Because we have people that come and do an MPH degree before they ever started medical school. They do it in the combined 4-year MD MPH. Some decide after they think about it more that they're going to do their medical degree, go off and do residency, and there are, especially for people who primary care train, often general medicine or general pediatrics fellowships, some of them sponsored by organizations or foundations like the Robert Wood Johnson Foundation, will actually pay for your MPH degree as part of that fellowship, and actually it's a formal expectation of the fellowship that you are getting a graduate degree, and some of those programs are actually funded by the fellowship program itself, and not just all funded by foundations. There's advantages of that model, in that often it's tuition-free, often it's embedded or part of another training program like a fellowship program. And another thing is, especially if you're going to, let's say, this is where it becomes important what you want to do with your MPH degree. Because Kathy mentioned a lot of people wanting, at least some of those in her class, wanting to do clinical research, getting involved in sort of the methodology, whether it's clinical trials or it could be epidemiology studies. In some ways, if you're going to be getting an MD degree and an MPH degree, sometimes students say, well, if I'm going to be more of a researcher, I would rather get my MPH training and some of those epidemiology, biostatistics skills sort of more contemporaneous, or at the time when they finish their clinical training and they're ready to get those research skills, and then right after the MPH, go into some kind of an academic position where they're involved in research and using those skills. Compare that to somebody who learned their epidemiology, biostatistics 7, 8 years prior to that, not as fresh in their mind. At the same time, we have lots of students who come to us at Tufts who want to see careers that aren't necessarily focused on clinical research. They see themselves doing global health, health management and policy, environmental health. And I think in their case, while the quantitative sciences are important, probably not quite as important of honing those methodologic skills right before they go into research. And so for them, the fact that they studied management and policy 6, 7 years ago and then do residency training and fellowship training, and now they're sort of going out and using it, maybe a little bit less of an issue in terms of some of the knowledge and skill recall. So let me pause there, just see if we raise a number of questions that people want to ask me about.
All right, Paul, we do have a couple of questions for you. We start off with, let's see. Hi, Paul, an audience member says, what is the difference between an MPH and a PhD in public health? And how would you advise someone in deciding between the two?
Right. So an MPH degree is a professional degree, as opposed to, you said the comparison is MPH with PhD, or was it a different? I want to make sure I'm answering the question properly.
Yeah, that's correct. The difference between
MPH
and a PhD in public health.
Right. So the doctorates in public health, there's even two different kinds there often. There's a PhD and a DRPH. The PhD in particular is, unlike an MPH, which 2 years to get a master's, a PhD is, 6, 7 years, let's say. And it's truly the kind of terminal degree for somebody who wants to be more of a academic. And that doesn't mean that all people with PhDs in public health do academics. Some actually use that degree and go out in the business world even, or they go out and work in, policy and government and all sorts of settings. But most of the folks often do think about academic careers, and they're really in that PhD training getting the kinds of research skills that they're going to need to sort of be competitive researchers in the academic environment. A master's program, for the most part, does not generally train people to be full-time academic research, especially if that's their degree by itself. Now, people with MD, MPH, a lot of them actually do go into research without a PhD degree, and really there, what's critical is that they're usually using the MPH part of their degree to get more of those methodologic skills in research, or at least quantitative methods, that they won't, for the most part, often get in medical school. Yes, medical school, you do take courses in epidemiology and biostatistics, but the amount of time you spend in coursework compared to MPH is much less. And so, so for somebody who's only going to get an MPH or only going to get a PhD, when students come to me and they say, well, look, if you really see yourself more as some kind of a professional, not necessarily in a full-time academic university position, then the MPH world degree opens up lots of different opportunities in the health departments. You can use it in universities to even teach, but usually not at the graduate kind of student level. I mean, there are people that get hired with MPH degrees that sometimes help out and do teaching in health sciences or even public health courses, sometimes as adjunct teachers at a college, but usually in most colleges and universities that full-time academics often have doctoral degrees. But if you think the breadth of what MPHs do, from working in state and city health departments to working in healthcare organizations, hospitals, neighborhood health centers, to working in the healthcare finance, whether it's in those kinds of organizations or health insurers, to go out in the field, working with all sorts of organizations in field-based public health, domestically, globally, prevention initiatives, etc. Really, one of the advantages of an MPH degree is really the breadth of what it represents. So I hope I try to capture a little bit about the difference between a PhD and an MPH in terms of both the amount of time and often the job career focus.
Okay, another question is that you mentioned that you got your MD, JD. Why did you decide to go back and get the MPH?
It's an interesting question. I decided to get it because I was very turned on, both in medical school and in my law training, in particular, about health policy. So here it was, I trained as a physician, and although I was intrigued and enjoyed issues in medicine, I don't just mean bioethics, but sort of the ethical issues about why is it we have people who are uninsured in America, why is it that we have health inequity kinds of things. In law school, you learn the language of law and policy, and you learn how lawyers often, yes, they do things transactionally or through the courts, but they also do things legislatively, make policy change. And although I got exposed to both of those things, when I heard about public health, I heard about, in my case, health services management and policy training, the clinical side a little bit.
Paul, you're cutting out a little bit.
So synthesis of the law training, the synthesis of both my medical training and law training, and then public health was helping me to round it out in a population health sense, and I don't regret that decision. And, in many ways, I also trained as a physician in one of the least populated specialties called preventive medicine and public health. So I'm technically what some people call a public health physician, and really have had a broad career. Some of it, or the last 10, 12 years in particular, has been based in the academics, but I've been a healthcare manager, a vice president of a hospital, getting involved in a variety of different medical affairs and medical policy issues affecting the medical staff and how, around issues of quality of care. I've worked for a large academic system here in Boston. We were trying to think about population health issues brought to certain neighborhoods in the city, and how do we sort of analyze and do needs assessment and help neighborhood health centers get involved in that. I've been involved in some major policy initiatives, for example, developing the sort of thought about what we expect from hospitals to be, if they're tax exempt in America, what do we expect them to return to communities. And really, have done some of that was university based, but some of it was really, based more from working cooperatively with some state government people and policy people. And then these last couple of years, I got appointed to the State Health Policy Commission in Massachusetts. I'm one of the commissioners in our pioneering 2012 law that's trying to focus on the growth in healthcare spending and how to reduce its growth and cost issues. And I find even amongst my commissioners, having a lot of the issues that come up about how do we, for example, today we're having a policy discussion and debate about how to improve behavioral health in our state, and having a background in public health in addition to medicine and law has been, integral for me of sort of putting all those pieces together. And so that's really how I've tried to integrate my own education and training.
Okay, we have a couple of questions here for you. Here's one. Hi, Paul. I currently work in public health, and I'm applying to medical school. I know that I want to ultimately work at the intersection of clinical medicine and population health, but I'm not sure what exactly that will look like. Can you provide some more insight on possible career paths that integrate the two fields?
Sure, I'll give you, and this is probably as ripe a time as any for somebody wanting to think about that in terms of how the healthcare delivery system is evolving. So for a whole host of reasons, access, cost, and quality reasons, we're moving away from an historic model of medical care, even for doctors, where we just took care of one patient at a time. We only thought about things one patient at a time. And now our healthcare systems are being challenged to say, well, wait a second, it's too expensive, that approach, and quality sometimes falls through the cracks when you only look at things one at a time. So we're being challenged now to say, let's have healthcare systems, including physicians that work in them. While some of them might still be delivering clinical care a portion of the time, we want those same doctors or other clinicians to be involved in thinking about population health strategies. How do we look at an enrolled life of 20,000, 30,000, 50,000 lives, let's say, in an HMO, that we, the health system, have taken financial risk for. Let's look at epidemiologic data and utilization data about those patients and what kinds of illnesses, conditions they've had, what kinds of utilization of healthcare they've done this last year. How does what does they do compared to norms? When we see groups that maybe overutilized or underutilized in certain ways based on analyzing that data, how do we then ultimately institute programs that both keep people healthier but also have people work in teams to reduce the total spending as we move away from fee-for-service, that's kind of risk-based. So in summary, what I'm saying is if you're somebody who can understand clinical medical issues but also can understand population health issues from epidemiology, from healthcare finance, from health policy, to how do you do good communications and form teams, you're a vital contributor in the healthcare delivery system as it's evolving from here on in.
All right. Next question is one that's very popular. I used to do recruiting for the School of Public Health at Berkeley, and I get this question a lot. So, Paul, does getting an MPH help you? Getting an MPH first, does that help you when you decide to apply to medical school? Will that look more favorable on you?
Well, let me put it this way. I think medical schools, increasingly, as they're going and examining the fact that in order for physicians in the world to come to be the kinds of people that can work effectively in teams, work across disciplines, okay, that while having an MPH degree doesn't absolutely guarantee that they're going to soon have those kinds of perspectives and skills, I think increasingly in a lot of people's minds they're seeing that kind of broad population thinking and training as clearly a net plus. Now, I'm not going to tell you that to get into medical school, having an MPH degree is going to substitute also for having basic science grades that they consider or MCAT scores. But at the same time, there's just a general emphasis, I think, across most medical schools, in wanting to have a more diverse cohort of students, racially, ethnically, by background, hopefully socioeconomically, but also diverse in the sense of students who want to come in and be part of these kind of population health problem solving and not only focused, on the one patient at a time or the biomedical model. Clearly medical schools, medicine needs people who are going to be biomedical researchers and primarily people who are going to be one-on-one clinicians. But I do think having the MPH degree is sort of signaling, along with having some of the other background aspects of your resume that I just mentioned. But having an MPH degree, I think, in general terms, in a whole file sense, makes you more attractive these days than how medical school admissions committees were even thinking 10, 15 years ago.
Okay, our next question from Wendy is how did your JD help you in your practice or your current career?
Very much in my current career. So at Tufts Medical School, I'm an administrative person for half my time, helping to run an MPH program where I do teaching, and I've taught health law to students. So having my legal background is directly relevant in teaching about healthcare law cases, as well as healthcare legislation and regulation. It also is just useful in thinking about public policy and health policy and explaining to the world from sort of a lawyering point of view, how laws come together with what the Supreme Court might do, and the executive, judicial, and legislative branches. Just understanding policy process. Very integral to Wells, the fact I'm a health policy commissioner right now, and understanding state laws and state regulation, what's under our jurisdiction, how to read the statute that identifies what our responsibilities are, and how to even argue at times that when there seems to be competing, let's say, I should say this, you could read our statute creating a health policy commission and read the public health department's statute and say, gee, it looks as if that we might have some overlapping jurisdiction on issues like how do we judge whether mergers and acquisitions of hospitals are a good thing or not, and we each have a role in that. So law and the skills of law and the language of law, and even running meetings, and understanding good process and Robert's Rules of Order and like that, and how committees relate to each other, some of which you get exposed to even in basic legal education. All that has sort of value, I would say, in trying to be effective in an operational process sense.
All right, we have about 5 minutes left, but we want to answer this this one last question by Wendy. She's asking, is there a difference between getting the JD and a health policy degree in public health? Because she's thinking it might be redundant. So would you be able to identify the differences?
Right. Well, so if somebody said to me, well, there are, if she means a JD and a PhD in public health, I do know people that have done that. We also have, for example, in our program, a JD MPH program, where again the students get the law degree skills, but they also get the MPH where they get the background, and this is really rich for lawyers. Lawyers often, some of them aren't really facile at quantitative skills, so if you're somebody who can do epidemiology and biostatistics along with sort of law, that sometimes is attractive, especially in the competitive job market. But I also get asked the question, if I want to do long-term healthcare policy, am I better off getting a PhD in health policy or a JD degree? And quite frankly, I don't think there's an absolute answer to that. I think if you see yourself primarily more based in university departments and positions, I think the PhD often gives you more choices and flexibility. If you only want to be a law school professor, then you should get the JD degree. But then at the same time, the JD degree often has greater ability and attractability, especially if you can understand health policy in many other kinds of settings. Although you go to think tanks and they hire JDs who do health policy, and hire PhDs and even MPHs that do health policy. So I'm really big on not anybody making an assumption there's only one right way to do things, including only one right way to educate yourself degree-wise. I think there's lots of different options there and different ways of educating yourself to ultimately do the career you want to do. But just probabilistically, or more often than not, you'll find that if you have a PhD in something, departments of health policy might be more apt in a university to hire you, or it could be in economics. And JD degrees, while they do get hired sometimes by university departments, often they find themselves more law school based.
All right. Well, thank you, Paul, so much for joining us tonight. We really appreciate it. Paul is also an East Coaster, so it's about 9:30 his time. But he was real quick to answer as well and really wanted to join in and help out as much as possible. So thank you so much for devoting time to work with us today, Paul.
Sure. My pleasure. One thing I do since I've been connected with Jeff and Healthcare Career Connections is I really say to students, whether they're my students at Tufts or I talk to lots of students locally, other schools in Boston, even around the country, where they sometimes have individual questions about different career options or choices or schooling, and I'm happy, especially with this audience in your webinar today, for people that want to contact me individually at paul.hattis, H-A-T-T-I-S, at tufts.edu, T-U-F-T-S.edu, and email me. I'm happy to schedule a phone time or whatever, because I see that as my important way of giving back. I was able to be supported by going and doing a lot of my formal education in state university settings where my education was subsidized, so I was fortunate to have only small loans when I got out of school. So one way of giving back is to help advise and mentor others. So I have no difficulty with that. And thank you for the opportunity to talk to this group.
All right, thank you. And of course, you guys should definitely take advantage of that. Me too, I got my degree at Berkeley, and it's because of all the mentorship. I had Jeff and people like Paul to reach out to, so you should definitely take advantage of that if you're considering getting the MD, MPH. A lot of the panelists who were on last week, the same too. We all went through HCC, and one of the things that we realize it's really important on like really who you know. And a lot of the people that you do encounter, they really do want to help you. As evidenced by Oliver, who was on the call last week, and it was 2:30 his time. So we encourage you, take advantage of us as much as possible. So thank you again, Paul, and I want to talk to you guys about next week's panel, and next week's webinar. We're going to be holding a webinar on getting into graduate school. So we have folks that work in admissions at UCLA, UC Berkeley, and Columbia next week. So if you want to get to talk one-on-one and send questions to those individuals, we encourage you to do that. If you know anyone that could benefit from these webinars, please invite them to come. We really are trying our best as possible to help you guys as much as possible, because we understand it's a very daunting process. You got to go through MCATs, GREs, and all this, and it's an incredibly stressful process. So one of the things that you can do to help relieve some of your stress is talk to people who've gone through the stress, who've dealt with all this before. So you don't have to repeat, like, say, the same mistakes or go through the same experiences. So we encourage you to check that out next week. So with that said, I'll wrap things up. And for anyone, if there are questions that weren't answered, I'm leaving my email up here. So sunnyv2007@gmail.com. You can shoot me an email. I'm really quick to answer them. And I can also try to connect you with Kathy as well. Kathy had to go. She was only here for 30 minutes, but she's also outstanding, and she's been doing work like this for quite some time. So definitely continue to keep us as a resource, as we're here to help you as much as possible. But with that said, we're going to close things off. And for any of your friends who didn't get to join in, we'll be posting the webinar online. So I'll have that up tomorrow morning. So have a wonderful night and take care. All right, bye-bye.